Hi, welcome to our channel of IGNOU Audiobooks. Indira Gandhi National Open University, School of Continuing Education, Certificate Programs, Certificate in Nutrition and Child Care, CNCC, CNCC-1 Nutrition for the Community. BLOCK-5, Nutrition-Related Disorders, UN-1T, 18 Major Deficiency Diseases 2, Anemia and Iodine Deficiency Disorders. 18.1 Introduction. In the previous unit, you have learnt about protein energy malnutrition and xerophthalmia, the two major nutrition-related disorders, which are common among young children in the rural areas as well as urban slums of our country. In this unit, you will be introduced to another two major deficiency diseases or nutrition-related disorders, anemia and iodine deficiency disorders. These nutrition-related disorders affect a large section of the population, particularly women and children. Anemia due to iron deficiency, and pockets of the population, iodine deficiency disorders. This unit deals with various aspects of these deficiency diseases, i.e., nature, clinical features, causes and control. Objectives. After studying this unit, you will be able to describe the nature and causes of nutritional anemias and iodine deficiency disorders. Identify the clinical features of anemias and iodine deficiency disorders and list measures for control of anemias and iodine deficiency disorder. 18.2 Nutritional anemias. Anemia is a nutritional disorder commonly seen among Indian women of low socio-economic group. It is also observed even among women of higher income groups. It 18 estimated that about 60 to 70% of pregnant women in the rural areas and urban slums suffer from anemia. Anemia is also common in preschool children, 1 to 5 years, school-age children and women in the reproductive age group, 15 to 45 years of age. Anemia is a condition where hemoglobin levels in blood fall below the normal levels. Hemoglobin, is a pigment present in the blood which gives the red color to the blood and is important for carrying oxygen to the different body tissues in the body. Hemoglobin is a substance containing iron and protein. Iron, Hem, plus protein, globin plus hemoglobin. In the case of normal and healthy individuals, the hemoglobin in blood is about 15 grams per deciliter, (Lu ml). However, for detecting anemia, the World Health Organization (WHO) has recommended certain cutoff levels of hemoglobin for different ages below which the individual is considered anemic. The cutoff level refers to the level of hemoglobin in the blood of an individual of a particular age group, below which that individual will be termed anemic. These cutoff levels of hemoglobin are given below for individuals of various age groups. Look at the screen for table content. Now, you would be interested in knowing deficiency of which nutrient results in anemia. Anemia can be due to deficiency of iron, which is a part of hemoglobin. In Unit 4, Block 2, you have read that folic acid and vitamin B also play a role in blood formation. Deficiency of these vitamins can also lead to anemia. Clinical features. The clinical symptoms of anemia arise when the transport of oxygen by the blood is insufficient to meet the needs of the body. The symptoms are, therefore, related to physical activity. The following flowchart explains this fact. Lack of hemoglobin leads to poor supply of oxygen to tissue, resulting in lower capacity to do physical work. As you know, the need for oxygen is increased during any physical activity like walking, running or doing any physical work. Therefore, inability to make a sustained physical effort is the common complaint in anemia. Usual symptoms of anemia are fatigue, giddiness, breathlessness on exertion, sleeplessness, palpitation and loss of appetite. Other clinical changes which appear include pallor or paleness of certain parts of the body. Paleness, pallor, is one of the clinical signs based on which anemia is diagnosed. Paleness of the tongue, conjunctiva, white of the eye, and nail beds is seen in an anemic person. In normal persons, when one examines the eyes by pulling the lower lids down, one finds that the conjunctiva is red. Similar is the case with the tongue. In anemia, due to reduction of hemoglobin, these appear very pale and whitish. The patient may feel that someone is pricking him/her with pins and needles, on the fingers and toes. Some patients may complain of chest pain due to reduced oxygen supply to the heart muscle. In severe anemia, the nails of the fingers and toes become brittle and spoon-shaped. Figure 18.1. The tongue may appear smooth and glazed due to atrophy, destruction of the papillae, numerous projections on the tongue. Severe anemia can even lead to death. The risk of death is higher in anemic women, particularly during pregnancy and delivery. You know that the normal term of pregnancy is about 9 months. Pregnant women with anemia are likely to deliver babies before completing the normal term, i.e. before 9 months of pregnancy. They usually give birth to low birth weight babies, birth weight less than 2.5 kilograms. Infection of uterus, kidneys and urinary tract are more common in anemic people. In general, anemic people are at a greater risk of catching infections. Causes. What are the causes of anemia? As you know, anemia can be due to iron deficiency or folic acid and vitamin B deficiency. The various causes of iron deficiency anemia can be clubbed under two main headings: dietary deficits and iron losses from the body. Let us learn about each of them in detail. Figure 18.1. Spoon-shaped nails. Look at the screen for table content. A. Dietary inadequacy. Dietary deficit in the body can be due to two reasons: low dietary intake of iron or reduced, low absorption of iron in the body. You know, the iron requirement is high in the body in certain physiological conditions, especially in infants, children and women in reproductive years, as a result of menstruation, pregnancy and lactation. If iron intake during these periods of life is not adequate, obviously anemia can set in. You may be surprised to know that many individuals among these do consume enough iron-rich foods, yet they tend to be anemic. What is the reason for this anomaly? You know that in India, because of economic reasons, many communities largely consume vegetarian diets. These diets do not contain sufficient absorbable iron, due to the presence of inhibitors. Animal foods from which iron is better absorbed, due to the presence of enhancers, are expensive and generally not consumed in most families in India due to religious and socio-economic reasons. B. Losses of iron. The second major cause of anemia is increased loss of iron from the body. In adult women, loss of iron occurs every month due to menstrual loss of blood. Apart from menstrual loss of iron occurs during pregnancy, delivery and lactation. As you know, in pregnancy the woman loses iron to provide for the iron stores of the fetus. During delivery, due to the loss of blood and iron content of the placenta, the loss is substantial. Similarly, when the women are breastfeeding their babies, they lose iron in milk. This poses additional demands for iron on them. If proper care of women is not taken during these periods, it can lead to anemia. Iron losses from the body are also more in case of people suffering from hookworm and other worm infestations. This is because worms residing in the small intestine of an individual feed on his/her blood. Heavy loss of iron from the body in conditions of surgery or accident can also lead to anemia. Folic acid and vitamin B deficiency. As you have learned, anemia can also occur due to the deficiency of folic acid and vitamin B12. Let us now study the causes of deficiency of folic acid and vitamin B12 in Indian diets. You have already learnt in Block 2 that these nutrients belong to the B complex group of vitamins and play an important role in red blood cell formation. As you know, folic acid is widely distributed in foods. Folic acid deficiency is common only among pregnant women who consume diets which do not contain vegetables, fruits, milk or animal foods right through their lives. We generally do not come across folic acid deficiency in people who eat foods like green leafy vegetables, fruits and milk regularly, which are good sources of folic acid. Women and children are affected by folic acid deficiency more than men. Anemia due to the deficiency of vitamin BL2 is rather rare. The disorder is due to failure to absorb vitamin B12, either due to lack of a substance called intrinsic factor, normally present in the stomach, or dietary deficiency. As you know, vitamin B12 is present only in foods of animal origin. Dietary deficiency may arise in people who are strict vegetarians or eat no animal products. This is one of the reasons why milk should be added to our diets, particularly to those depending on vegetarian diets totally. Treatment: hemoglobin in the blood can be raised by giving iron in the form of tablets. Ferrous sulfate, iron tablets, is the preparation of choice to treat anemias. 1 tablet, ferrous sulfate 150 to 180 mg, twice or thrice a day before food is recommended. This may cause certain side effects like constipation, discoloration of stools and gastric upset like nausea. The woman should be clearly told about the possibility of these side effects and be prepared so that she does not discontinue the treatment. In fact, a large number of individuals stop taking iron tablets because of these complaints. Treatment should be continued for at least 3 months after hemoglobin levels return to normal. In the case of infants and children, sweet liquid preparations, syrups, are available. In the case of folic acid and vitamin B12 deficiency anemia, tablets containing folic acid, 1 to 2 mg, and B12, 10 micrograms, are given. Associated infections should be treated with appropriate antibiotics. In areas where hookworm disease is common, suitable medicines should be given to treat the disease. Simple medicinal iron in the case of individuals with hookworm infestation will not be adequate to treat anemia. Prevent iron. Given below are the few preventive measures which can help to prevent anemias. A. Dietary measures. The most rational method of prevention of anemia is to ensure the consumption of diets adequate in iron by the population. The women, particularly those living in villages and urban slums, should be adequately educated about the importance of the prevention of anemia and should be encouraged to consume iron-rich foods regularly. Inexpensive sources of iron are green leafy vegetables, palak, amaranth, etc., rice flakes, and other vegetables like lotus stem, groundnuts. If these foods are consumed as sources of iron, care should be taken that enough vitamin C-rich and protein-rich foods are consumed along with them, as they enhance absorption of iron. Meat and liver are preferably good dietary sources if one likes and can afford them. B. Fortification of foods. One of the methods of ensuring adequate consumption of iron through diets is to add iron to a food item that is consumed by one and all daily. The method by which the nutritive value of diets is improved by the addition of one or more nutrients to a food item is known as fortification of food. The food selected for this should be consumed by all, particularly the needy poorer segments of the population, with very little daily variation in the quantities consumed. Common salt is consumed by the rich and poor daily in our country. It has been identified as the vehicle for fortification with iron. Studies have shown that consumption of common salt to which iron has been added leads to an increase in hemoglobin levels, thus reducing the prevalence of anemia. Though this program has not yet been initiated in the country, this will be one of the approaches to control anemia in future. Baby foods are also fortified with iron to protect infants fed for long periods on artificial milk formulas from anemia. C. Distribution of iron and folic acid tablets. You know that by giving iron tablets, the hemoglobin levels in the blood can be raised. One of the approaches that has been in practice in the country for over 20 years is the distribution of tablets containing iron, mmg, and folic acid, 500 wg, to the vulnerable sections of the community, those who are more prone to deficiency disorders: women, pregnant and lactating women, family planning acceptors, women who have been sterilized, or those using intrauterine contraceptive devices. These women may have more menstrual losses, and children, 1 to 3 years. The Government of India has been implementing a program called National Nutritional Anemia Control Program since the year 1970. Under the program, the beneficiaries receive 100 tablets of iron and folic acid. This is expected to control the widespread prevalence of anemia in the country. You will learn more about the two programs in Block 6. Simultaneously, the community should be educated to protect themselves against anemia by consuming foods rich in iron. You are listening to this audiobook on Audio Learn IGNOU. Check your progress exercise. 1. 1. List the population groups at risk of developing anemia. 2. Fill in the blank. Say, 95% of anemia in India is due to blank deficiency. B. Anemia arises when the transport of blank by the blood is insufficient to meet the needs of the body. C. In pregnant women, the hemoglobin level below blank in the blood is considered as anemia. D. Milk is a blank source of iron. 18.3. Iodine Deficiency Disorders. Iodine Deficiency Disorders, 100, present another major health problem in India. About 200 million people are at risk even in our country. It means, are living in areas where 100 is very common. Isn't it alarming? Till recently, the disease was observed only in the Himalayan and sub-Himalayan belts of India, hilly regions, extending from Jammu and Kashmir in the north to Nagaland in the east. In the recent past, however, newer areas south of Vindhyas in Maharashtra, Andhra Pradesh, Karnataka and Delhi in the north are being identified as regions where T100 is becoming more common. The term IDO includes a spectrum of disabling conditions affecting the health of humans starting from life ill in the womb through adulthood resulting from an inadequate dietary intake of iodine. Causes. Iodine is essential for the normal functioning of an endocrine gland known as the thyroid gland. This gland is located in the front portion of the neck as indicated in the following figure. Location of the thyroid gland. Look at the screen for table content. The secretion from the gland of a hormone called thyroxine is very important for normal human development and health. Iodine helps in the formation of thyroxine. When iodine is inadequate, the thyroid gland enlarges in an attempt to produce thyroxine for the body's needs. We require very small quantities of iodine, 150 ug per day. You have read in Unit 5 of Block 2 that usually we can obtain this iodine through foods and water. In areas where IDD is very common, the environment is deficient in iodine, so soil, water and foods have greatly reduced amounts of iodine. In mountainous and hilly regions, environmental iodine deficiency occurs due to years of washing of the soil by heavy rains and glaciers. In the case of plains, repeated floods deplete the environment of iodine. As a result, water and all animal and vegetable foods dependent on the soil are deficient in iodine. Thus, when foods which are deficient in iodine are consumed, the diet will also be deficient and this produces iodine deficiency. Apart from this, certain chemical substances called goitrogens, goiter-producing substances, interfere with the utilization of iodine by the thyroid gland. Foods like cabbage and radish are known to contain goitrogens. Consumption of these foods in large quantities in some cases may produce iodine deficiency. There is, however, no evidence, as yet, to state that these foods by themselves produce 100, at least in India. Clinical features. Goiter and cretinism are the best known and easily recognizable forms of iodine deficiency. However, you should remember that these are not the only manifestations of iodine deficiency disorders. In fact, the term iodine deficiency disorder includes a spectrum of crippling conditions affecting the health and well-being of mankind starting from early in fetal life through adulthood, as we mentioned earlier. Other manifestations of iodine deficiency disorders are indicated in Table 18.1. Table 18.1. Spectrum of iodine deficiency disorders in approximate order of increasing severity. Look at the screen for table content. Let us study the clinical manifestations of both goiter and cretinism. Goiter. The word goiter means swelling/or enlargement of the thyroid gland. As you have read, in case of deficiency of iodine in the body, the thyroid gland enlarges in order to trap more iodine, whatever is available. The swelling or enlargement can vary 10 sizes depending on the severity of the goiter. In fact, you can grade goiter based on the size of the swelling of the neck. At one end is the swelling which is only visible on careful examination with the neck of the patient stretched, and at the other end is the big, monstrous goiter which can be seen even from a distance. The prevalence rate, the number of cases in 100 individuals, of goiter increases with age reaching a maximum at adolescence. It is more frequent in girls than boys. In fact, if one wants to find out whether goiter is a major problem in an area so as to start a control program, the goiter rate over the ages 8 to 14 years is used as an indicator to know whether an area is endemic, highly affected area, for goiter or not. A prevalence of 10%, i.e. 10 girls out of 100 of this age examined, is taken as an indication that goiter is an important health problem in that particular area. Figure 18.2 Goiter. Look at the screen for table content. Cretinism. It is the most severe manifestation of 100. Cretinism refers to the adverse effects of iodine deficiency on infant and young children. Let us see how cretinism sets in. Iodine deficiency interferes with the brain development of the fetus. This means it can cause irreversible brain damage even before birth. If an infant is born to an iodine-deficient mother, he or she is likely to suffer from hypothyroidism. If this condition of iodine deficiency or hypothyroidism continues further after birth, the child may suffer from a series of disorders which may include mental retardation, growth failure, speech and hearing defects, neuromuscular disorders, paralysis. All these defects might lead to a mentally retarded deaf mute or cretin, a child suffering from cretinism. Fortunately, there are very few areas in our country where cretinism is common. However, it has been found that in severely iodine-deficient areas more than 80% of children are disabled to some extent due to LDD control. Since 100 is primarily due to reduced intake of iodine, the control strategy aims at ensuring sufficient intake of iodine by the population living in areas where 100 is common. A few methods that have commonly been used to increase the iodine intake of people residing in endemic regions include 1. Addition of iodine to salt. 2. Use of tablets containing potassium or sodium iodide. 3. Use of iodized oil. Let us discuss each of these methods separately. 1. Use of iodized salt. The oldest and the most extensively used method is fortification, enrichment, of common salt with iodine, potassium iodate. You have earlier learned that salt may be used for fortification of iron to control anemia. We consume on average 10 to 12 s of common salt every day. For 10 grams of common salt, about 150 Ug of iodine is added. In other words, daily consumption of common salt would ensure the daily requirements of iodine. The iodized salt, common salt to which iodine is added, smells, tastes and even looks exactly like the common salt. Nowadays, in the market in a number of towns, several brands of iodized salt are available. You would realize that it is difficult to differentiate the same from unfortified common salt. The procedure of iodization is simple and costs little. In India, distribution of iodized salt in the endemic areas is in practice for about 25 years. In these areas, entry of non-iodized salt is completely banned by law. However, for various reasons, mainly due to inadequate supplies of iodized salt, salt which is not iodized is being sold in the areas. The Government of India has now decided to make available only iodized salt by the year 1992 so that non-iodized salt is not available in the market. According to the available scientific evidence, consumption of 156 Wg iodine per 10 grams of common salt per day by humans even in areas where goiter is not common may not be a health hazard. 1. Use of tablets of sodium or potassium iodide. provision of sodium/potassium iodate tablets to school children and addition of iodine to the drinking water supplies have been tried in some countries. However, this is not a widely accepted method of administering iodine. 2. Use of iodized oil. During the last decade, injection of oil, to which iodine has been added, has been adapted for the control of goiter and cretinism in areas where the IDD is severe. The advantage is that an injection of 1 milliliter dose of iodized oil can provide protection to an individual for 3 to 5 years. But this is more expensive, and reaching all those at risk by this method is difficult. It is used as a temporary measure, particularly in areas which are not easily accessible and iodized salt may not reach due to communication problems. You know that giving injections to a large number of people is difficult, and the people also may not accept them. Hence, efforts are being made to use iodized oil to which iodine has been added, by mouth for controlling goiter. This will also be equally expensive as injections of oil. But of course, the acceptability by the community will be better. Among the various methods available for control of IDD, salt fortification seems to be the method of choice for a long-term solution to the problem. In fact, fortification of common salt with iodine is the major aspect of India's national program for control of iodine deficiency disorders. Education of the people about the dangers of IDD and creating political will in the country are important steps in this regard. It is only when the community is sufficiently aware of the various dangers of IDD can we succeed in the implementation of the iodine prophylaxis program, where iodized salt is distributed to the communities in the endemic areas. You will learn more about this program in Unit 23 of Block 6. Check your progress exercise 2. 1. Which are the areas in India where iodine deficiency has been prevalent for years? 2. List the methods of control of iodine deficiency disorders. 3. Fill in the blanks. A. Iodine is required for the formation of the blank hormone. B. We require blank Ug iodine per day. C. Substances which interfere with the utilization of iodine by the thyroid gland are called a blank. D. The most suitable method for control of iodine deficiency in India is use of blank. E. Blank and blank are the most easily recognized forms of IDD. 18.4. Let us sum up. In this unit you have learnt about two major nutritional deficiency disorders, i.e. anemia and iodine deficiency disorders. Nutritional anemias are common in women, particularly during pregnancy and lactation. In India, most of the anemia is due to iron deficiency. The anemic subjects have easy fatigability, giddiness and breathlessness on physical exertion. Paleness of conjunctiva, tongue and nail beds is present. In severe cases, chest pain and spoon-shaped nails may be present. Dietary inadequacy, menstrual loss and frequent pregnancies in women are important causes. Iron tablets should be given for treating cases of anemia. Nutrition education to consume foods rich in iron and the distribution of tablets of iron and folic acid to vulnerable groups are important measures to prevent anemia. Iodine deficiency occurs due to the reduction of iodine in the environment, i.e. in soil, water and foods. It leads to iodine deficiency in the diets. The commonest manifestation is swelling of the thyroid gland, goiter. Cretinism presents the most severe form of iodine deficiency disorder. It is characterized by mental retardation, growth failure and deaf mutism. Goiter and cretinism present extreme ends of the spectrum of iodine deficiency disorders. Within these two forms of IDD are several others. Iodine deficiency can be prevented by enrichment of common salt with iodine. This program is in operation in the country for the past 25 years. Injections of iodized oil can protect the population from iodine deficiency for 3 to 5 years. Nutrition education of the community to utilize the services will be important in the control of IDD. 18.5. Glossary. Deaf mutism, inability to speak due to deafness occurring since birth or early in life. Deciliter, 1/10 of a liter or 100 milliliters. Deworming, treatment for removal of worms like in roundworm disease, hookworm disease, etc. Endemic, a disease that more or less prevails continuously in a given region. Endocrine gland, organs that secrete specific substances, hormones, which are released directly into the circulatory system. These glands influence metabolism and other body processes. Family planning acceptor, women who underwent sterilization operation or accepted intrauterine devices to prevent pregnancy. Hypothyroidism, condition resulting from lower than normal levels of thyroxine. Intrauterine device, a device which is placed in the uterus of women as a measure for family planning. Palpitation, forcible pulsation of the heart perceptible to the patient. Papillae of the tongue, numerous projections of the mucous membrane on the tongue. Stillbirth, delivery of a dead fetus. Squint, abnormality of an eye which does not turn to match the other eye's direction. Spasticity, stiffness of the limbs is characterized by muscular weakness, walking difficulties and mental deficiency. Thyroid gland, an endocrine gland located at the FRNT of the neck. Thyroxine, active iodine compound made in the thyroid gland and functioning as a hormone. Thank you. We will see you in the next video.